Welcome to a little course bonus, something that's designed to help you learn about metacognition and how to perform better on your nursing exams. I'm Professor Ford, and let's get started on this adventure. So when I first started college and nursing school, I did not understand what metacognition was. Nobody in, my high school prep or anything like that had ever prepared me for really truly what metacognition is there for. And as humans, metacognition is something that sets us apart from all the other animals. So in short, metacognition is really the ability to think about our own thinking. So I can step back and think about the process of thinking that's going on in my mind. It's really being consciously aware of yourself and really your problem solving as it's happening. You're able to step back and say, I'm going to use this method, and now I'm going to try this method. And that didn't work, so I'm going to try this method of problem solving. It also gives us a way to monitor, control our own mental processing. Am I understanding? So when it comes to learning, am I understanding this material? It allows us to accurately judge our own level of learning, and that is something that we have to continue to do as students and as professional nurses. So we're going to take an exploration into Bloom's taxonomy. I want to pause before I put that slide up because to understand Bloom's taxonomy is to really kind of revisit our knowledge of Maslow's hierarchy of needs, right? So just as you've been learning that in the physiological processes of humans and the needs of humans that is cross-cultural, there is this need for, physiological needs and then safety and then belonging, and it kind of goes up into the top of that pyramid. We're going to now look at a similar pyramid but designed to show the layers or the basic layers of learning. So as we look at this great pyramid, Bloom's taxonomy, we're really looking at the different levels of thinking that we go through when we're learning. We can even apply this, across ages. When we think about remembering, first of all, the first step of learning something is just to retrieve it, to recognize it for what it is, to recall relevant knowledge about it from our long-term memory. We oftentimes see this in speech for kids. We'll utilize a word over and over again. And eventually we build upon that and start to come to understand things. This is when we start to put meaning with any sort of either oral or written or graphic messages or images that we have, and we're starting to interpret and exemplify, classify, moving things into one category or another. Oftentimes we'll use the word summary when we're talking about understanding something. Can you summarize that into, say, an elevator pitch, something that's 30 seconds or less, and tell me about that topic. Oftentimes we're also starting to infer when we understand something. We're comparing it, we're contrasting it, we're able to do a basic explanation. Above that is the application, and when we think about it, you have to remember something, you have to understand it before you can apply it, and that's really execution of an idea or of a thought or of an understanding of a process or implementation. It is us carrying out something, utilizing what we understand and what we remember. And so applying is actually putting it into practice, right? Above applying becomes analytical. So that's when we start to take material that we've learned, that we understand, that we've already started to apply, and we're breaking it into parts, kind of determining how they relate to each other, how do they relate to the overall arcing idea, and that begins this kind of synthesis of understanding in us that's even at a higher level. And so as we accomplish analyzing, then we start to getting into evaluating. And the evaluating level of Bloom's taxonomy is when we're making judgments based on criteria and standards. We check things, we're critiquing things, we're looking at the pieces, and then we're saying, nope, that's not correct. I'm going to change this so that it fits correctly. And that is the leap that we take into creating, where we take those elements that we've broken down, that we've looked at, that we've analyzed. Now we've looked at them and said, nope, that's not quite right. And we start to put them together into this new pattern, this new structure. And it's getting us we're starting to plan and produce, and we're making something new out of what we've learned. And this is the highest level of Bloom's taxonomy. So let's think about this in nursing terms. Let's talk about something that you might have learned already in nursing school. Let's talk about placing a Foley catheter, right? And so when we first start that process, oftentimes someone is going through, this is a Foley catheter, this is the balloon, this is the port. They're defining it for us. And part of our learning means that we have to remember what those parts of it are. So remembering is really recognition, right? So really you're starting to go, oh yeah, that's the port. This is how it shows up in the case. I identify it by looking at it. That's remembering. That's a kind of a memory type thing, right? And then understanding. So, as we talk about Foley catheters and as we talk about the purpose, we might show you the tip that allows the urine to flow into it, that it's a gravity flow in that sort of situation. We might explain how the air port works and how we might draw a little bit of urine out of it. And so this is all contributing to your understanding, right? This is something where you're touching it, you are looking at it, you're classifying it, you're starting to go, oh yeah, I know what it's for, I'm understanding why this is an important concept or an important task that I need to be able to do. And then we ask you to apply that knowledge in class, and typically it's not even just in class. We're asking you as a nursing student to apply it in the lab clinical situation. And so here we're asking you maybe to execute this procedure of starting a catheter. And this means that you have to remember what are the steps of creating a sterile field. What are the rules about sterile fields? What is in this kit and what order do I need to do it in? Understanding the purpose of why we're doing it. Can I explain this to my patient while I'm doing it as I'm carrying out this procedure? So that is an example of remembering, understanding, and application. So now, in the testing situation, I might also be asking you to analyze which patient is most likely to need a urinary catheter. This means you're going to have to remember certain data about the criteria for starting a catheter. You'll have to understand its purpose, right? And you'll be applying that to a patient situation or scenario in the test and then saying, yes, does this relate to the overall? Yes, it does. Let me put it into an analysis. And then suppose there's another question on there, and it might even take it a little bit further. Your patient's starting to have complaints that they feel like they have the urge to void, and they feel like their abdomen is more tender. And so you start to even analyze for what is the issue going on, and you start to evaluate. You're starting to make judgments based on what your findings are. So you're analyzing for what could be causing this issue for my patient. And as you're evaluating, you start to check, you start to critique. Is my bag lower than my patient? Is my bag's tubing unkinked? Is there something that could be impeding it? Could it not be in the right place, right? And then you're creating solutions based upon what you find during that analysis. So now you've analyzed it, you've determined the problem by evaluating. Now you're going to create your solution. You're going to unkink the tubing, get rid of the airlock, ensure that the Foley catheter is hung at the right level for your patient. And now you're also creating this extra memory, right? So now you've gone all the way up through Bloom's taxonomy with relationship to this. Now you're also able to apply this experience to future experiences with Foley catheters. And so that's just one example of how Bloom's taxonomy can occur from labs, from lecture to lab setting to test exam to clinical practice. And so that's why testing can be so difficult for nursing students, because we're really starting to increase where we're asking you questions about, and we're asking you to start to apply that information, analyze it, evaluate it, and then creating new solutions. And so when you think about in high school, or even early college, at what level of Bloom's taxonomy did you have to operate to make A's, B's, or C's? You had to remember, right? Did you have to understand? Sometimes yes, sometimes no. Sometimes our exams were just rote memory. Sometimes they were full of application. But then as we look at high school, there was maybe in an advanced English class, maybe somewhere where you were applying and analyzing. Maybe if you were doing more higher level AP courses, you got a touch into that evaluation and critiquing and then creating something new from the parts. So maybe this level of blooms isn't so hard for you to stretch your mind around, but for the bulk of what we do in our younger years and our learning, a lot of it stays in that remembering, understanding, and then occasionally jumps up into the application and analyzation. But here we are in nursing school, and in college, that level of learning starts to go up. We don't always prepare you for how testing is going to test at different levels of this pyramid. And so sometimes I think just understanding that you are already going up into that application, analyzing, evaluating, and sometimes even creating in our exams. But definitely at the patient's bedside, you are going to be utilizing all of these steps of Bloom's taxonomy in your learning, and you're going to be creating new solutions. And hopefully you'll be one of those amazing creators who goes on to create even more, whether that's in informatics or whether that's in product development. But truly, even at the bedside, we're still creating solutions. We're creating things based on the knowledge and the understanding and the analyzation that we've built upon. So metacognition is really about being systematic with your thinking and thinking about how you think, right? And so it's also about applying yourself into studying. So how do you move yourself up higher on that Bloom's taxonomy when you're studying? How do you apply thinking about your thinking and being intentional with your studying so that your test scores are where you want them to be? Well, there's several steps we're going to go over. We're going to learn about using a study cycle. We're going to learn about kind of our best ways of learning, and then we're also going to learn some ways to analyze where our mistakes have been in a way that we can reapproach learning and be thinking of it in a metacognitive way so that we can avoid those errors or mistakes in the future and become more efficient at studying for nursing exams. So here is the study cycle, and for some of you this will work incredibly well. For others, it may be a review of things you've heard in the past, and there may be certain steps of it that you don't necessarily use as often, but then now you may find maybe more helpful now that you're in nursing classes. So let's just take a little look of it. It really starts with previewing. Now previewing can start with, here's our outline for the class. Here's the material we're going to cover. Can I preview in my textbook? Can I skim it? Yes, maybe no. Sometimes this only needs to be a minute or two process. It may be as soon as I announce in class, here's the topic we're going to go over. You can kind of glance through either the slides or glance through the textbook and look at it and say, oh, okay, so our overall arching topic today is blank, 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 right? And then, the next step, of course, in learning and in the study cycle is attendance. And truly, sometimes we overlook the importance of being present. And that just doesn't even mean being present physically. It means being present emotionally, intellectually, thoughtfully, and intentionally in your classes, right? And I can think of 1,000 classes I've taken where I have drifted kind of off the little thought boat, down a little creek in my head, and suddenly I'm pulled back to the class and I have no idea what's been said over the last 10 minutes, and I have no idea what topic we're on. And so really, this attendance isn't just about being physically present, it's about emotionally and intellectually engaging in your course in a way that you can have conversations and answer the instructor and have a back and forth and ask thoughtful questions. This is a requirement, I think, in nursing school, is that you are able to engage in those upper levels of thinking while you're also in class. And so, whether or not you take notes, that's always up to you. How you do so, how you process, it may not always be sitting simply writing out notes or typing out notes. That's a different process for each person. But after the class, at some point, you should also review, right? So then you go back through maybe the slides or whatever notes you've taken, or you re-listen if you've been recording lectures. And this review is really, it's much more important than we sometimes let on. Oftentimes when you come out of class, especially if it's a lecture on PowerPoint, you're going to remember somewhere between 10 and 20% of the material. You know, we are very good at telling stories to try to help you remember certain points. We might use some pretend test questions to help you apply and understand what we're asking for. But this review is what helps you to sink in more of what's come from class, to really find those important pieces and store them somewhere in that longer term memory. It's best done when you do it soon after class, that same evening or the next morning. But what I usually say is, if you review with intention. Don't review and have YouTube on in the background or music on in the background. Review with asking yourself some questions about the material and going back and trying to just remember the answers from our discussions. I usually find that review goes best right after you've slept or right before you've slept. So because a lot of our long-term memory succeeds when we have adequate rest, right? We tend to store while we're sleeping. Oftentimes a little review session right before you go to bed will actually help to store that data in your long-term memory at an easier access point for you, meaning you won't have to strain so much to remember some of those details. And so please don't skip review. Even if you don't do preview, do attend and do review. And then of course in nursing school you are going to say, I have to study. And I completely agree. Repetition, the more often you study something, the better you start to learn it. You need to be asking yourself questions when you're studying. Why? How? What if? And what if is probably the most important question in nursing that you need to ask. So for example, I have a patient who needs a Foley catheter started, going back to that. And I know the process, and I go in and I go to start that Foley catheter, and it's on an older male gentleman, and I have difficulty threading the catheter. What if I have difficulty? What if I can't get that catheter in? What does it indicate? What do I do? What could be the problem? What are my choices from here? Analyze and think about how you're thinking and how you're responding, and then think about what actions you would need to take. Do you need to call the doctor? Do you need to presume that maybe you're in the wrong position, or that there's something, what other problem solution solving issues can you take on? And by doing that, you're actually starting to think at those higher levels. You're learning at those higher levels of Bloom's, and that is going to serve you well when you come to take the exam. Assess is the other step of the study cycle, and that is assess your learning. So periodically, think about a reality check. Gee, am I studying effectively? Am I using tools that I know are useful? And the golden question, after you study anything, after you learn anything, is, can I teach a patient about this? Do I have enough information to teach it to a CNA? Do I know enough about this to teach it to an attorney who's asking me questions in a court setting? Now, and at the bottom of this slide, you'll notice that there's some intense study sessions and some guidelines for that. I think that that's great, but that amount of time doesn't always work for everybody. I think our brains, especially when we're working on difficult topics, can fatigue out sooner than the 50 minutes that they say to study hard. So I think what works well is usually some form of a Pomodoro technique. Pomodoro just means tomato in Italian, and this is something that you can find a lot of apps online for, and really it's about taking pockets of 25 minutes and concentrating really hard in quality time, and then after each 25 minutes taking a 5-minute break. And then after the fourth cycle, taking a much longer 30 to 45-minute break, and then repeating the process in the afternoon or in the evening. And I find that that's a fairly efficient way to study, because if you can tell yourself that you are going to check your messages and your emails on those 5-minute breaks, or send a snap on your 5-minute break, it's a little bit easier to focus during those 25 minutes. And even if you only do 1 or 2 cycles of the 25 minutes, 5-minute breaks, that is actually how you get to that 50 minutes or that 45 minutes within an hour or so, but that's effective study time. Okay, so let's look at some other effective metacognitive strategies that you can put into place and use. One of those is solving problems, answering questions, not always looking at that example or the solution. And that may change when we get you ready for NCLEX test time, but it should help to build some of that innate response of, kind of where, what the solutions may be without really seeing all the list of selection. Memorize everything you are told to memorize. For example, when I say memorize Erickson's developmental theory, it's going to show up repetitively throughout nursing school and onto your NCLEX. Do memorize that. Go back through and commit that little piece to memory. One of the most important things about nursing is that we know where to find information, but that we've memorized the appropriate information that we can draw on. Always ask why, how, what if questions, and those what if questions are probably the most important question. Spend time on nursing type thinking every single day. You should be analyzing people in the grocery store. You should be responding as if you're a nurse when you're out and about, and just practicing that nursing type thinking. Practice for exams. Practice for them and test your own understanding by giving mini lectures on little concepts. So even if that means you are giving a lecture to your dog on the importances of sterile technique and using that in procedures like starting a catheter, those are important things to be able to talk your way through. And so keep testing yourself by giving out those mini lectures. When you find that you don't understand why, go back and review that material. Use your study cycle. Use those intense study sessions, whether you do that as it's outlined in the study cycle or whether you do that in using some sort of Pomodoro technique or whatever works for you. That intensity and that focus during study time is really what's going to help downlay that into your long-term cognitive memory. We as nurses never aim for mediocre. We always aim for, basically exceptional. And so aim for 100% mastery. Don't settle for 50% or 75% or even 90% mastery. Look for 100%. Expect the highest of yourself, and you will start to achieve more. At the same time, be gracious with yourself. There are some times in our lives, and sometimes when we're studying, that we cannot focus all that we have or all that we want onto a particular topic. Mark it. Come back to it again later, and refocus on it at a time when you can really concentrate and put that into that long-term memory bank. Another great way to build memory, to create kind of higher order thinking, is to utilize concept maps. Those really help facilitate that higher order thinking skill and allow you to look and reclassify and rethink about how you're thinking about the topic you're studying. Here's an example of a concept map from the textbook for fundamentals, and it's really on urinary elimination, and it talks about, what's the structure, the pathophysiology, and then it breaks it down into the yellow of urinary formation and urine elimination, and then takes it down into even deeper areas, all the way down into the blue zone. And the blue zone is where we really look at nursing diagnoses. And so whenever you're struggling with a concept, make yourself a concept map. It allows you to categorize how that fits and how it gets stored into your brain. Eventually, as you make more of those concept maps, or the more that you become familiar with them, the more crossovers you will have in your brain that you can draw from when you are creating care plans or when you're drawing concept maps for OB or PEDS. And ultimately, as a nurse, it allows you to draw from a much larger expanse of nursing diagnoses and processes. Not that you're going to sit there and go, oh, my patient has, altered skin integrity, but you're going to naturally start to do things that are going to create those nursing steps to prevent damage to the skin. Here's another example of a concept map, this one looking at health and illness and how we categorize or think of it between holistic and on the continuum and the disruption of health and the experience of illness, and then even breaking it down into the nursing process, how we assess, how we diagnose, intervene, and then how we evaluate our outcomes. And that process will become more natural to you over foundations as we hit into care planning, and then even more so in 352 or in your further classroom experiences and clinical experiences, where you will start to take that nursing process and concept map that out in your head. It'll start to just kind of appear with a little bit less work on your end. So here's an example of a character map, a chapter map, and how, when you're previewing a chapter, how this might help you. What's the title? What are the primary headings? What are the subheadings? What are the secondary subheadings? That should give you an idea of the roadmap that we're about to embark on when we're learning this. And that then, by going through that little chapter concept map, allows you, as we go through lecture, to start to place it into one of those categories, or at least to be thinking about those categories and how might this content fit, and why would that be important. And as we create those, you also start to understand what is the most important parts. If as an instructor, the subheadings I skip are the pathophysiology, because you have such a great pathophysiology course, and I start in on what are the causes of this, then you want to focus in on the causes of, or what are the nursing outcomes of this, what are the nursing problems or interventions. And by focusing in on what I've lectured on, you'll know which parts of those maps and which parts of those chapters to go back and review. So now that you've studied, you've learned a little bit, how are you going to prepare for your exams? Let's talk about why we do well and why we don't do well on exams. So some common reasons why folks don't do well on an exam. They didn't spend enough time reviewing the material. They started their homework too late. They didn't memorize the information they were told to memorize, or maybe they didn't even crack the book. That is more common than us as instructors really want to admit. And then oftentimes, a reason why people are not doing well is they assume they understand information that they'd read, reread, but really had not applied in their head. And another reason why people don't do well on nursing exams is because they haven't prioritized their time, or they forgot that there was an exam coming, so they did not do really much of anything to prepare other than quickly read through their slides just prior to the exam. It helps, if you've done poorly overall on an exam, to look at those 5 reasons and be honest with yourself and say, these are the ones I need to change. So let's talk about why folks make A's on nursing exams. So most of those who make exams do some sort of preview or review for every class, or both. Oftentimes they'll do a little bit of the reading at a time, not just binge the entire chapter the night before the exam. They oftentimes will have reported that they've used the book, they've done the suggested problems or the works at the end, and this can even be extended to the Kaplan. If we have someone who does exceptional on an exam, most of the time I can track that back to they have worked their Kaplan subject mastery tests. Oftentimes those who've done well have made flashcards, they know the information that they needed to memorize, they've practiced explaining the concepts to someone else, and then they've also oftentimes reviewed their notes shortly after class, made additional notes or links, or made even sometimes making a concept map of the material we covered in class. Okay, so you've taken your exam. It maybe wasn't quite where you had hoped it would be. One of the most important things you can do as a student is to spend some time with that exam. Analyze your testing errors. Now this little slide here, I actually have this in a worksheet form. You can print it off for every exam that you take, sit down with it, and actually analyze the reasons why your exam didn't go as smoothly as you had hoped it would. It breaks it down into several categories. The top layer is knowledge, and so that's really looking back at, did I come to this test with the knowledge I needed? Did I know the information? Did I have it in my notes? Did I study it and was I able to recall it or not? Do I remember main ideas or no details, or do I remember details and main ideas? One of the things is a lot of times people struggle to apply the information, and then they need to prepare for their next exam by really concentrating in metacognition, really planning on how they're going to apply that information that they've got covered in that chapter. Sometimes the issue is people have studied the wrong information, and so just being able to know I missed that because that's not the content I studied is an important insight for our tests. One important area for nursing especially is in prioritization, and so knowing whether or not you have prioritized correctly or incorrectly. When you look at that question you missed and you say, doggone it, I did not prioritize correctly, that's an important key piece to remember as you go into your next exam, is really reviewing what are the priorities, what is the order I should go in. Did you know all of the vocabulary that was presented? So those are all knowledge things that we can fix with tutoring, with different study techniques, that sort of thing. Other categories in the yellow here is skills. And some of those selections are, I didn't read the test question or the answers correctly. I missed key words. I was careless and marked the wrong choice. I didn't notice limiting words or a double negative. I changed a correct answer into a wrong one. Oh, doggone it, I hate it when that happens. I implied information, or I, quote, read into the question, or this was an alternate format question. So this goes down to test-taking skills. And that is also something we can help by just accessing some simple utilization of Kaplan, by utilizing some exam study strategies and some strategies for answering, and also in our help through the university, they can help you with test-taking skills. And if you know that consistently you don't read the test question correctly, then on your second go through of your exam, when you go back to correct, you're going to check not your answers, but that you read each question accurately and that you have answered the correct question. One thing to be considerate of is those doggone alternate format questions. The NCLEX is full of them. And so those are things we can give you strategies. We can teach you tricks about when you're answering them, how to outwit your mind into selecting the wrong ones, right? Or to make sure that you've selected all the ones that are correct. So that's skill. Those are things that we can modify. The next section in the green that you can see is really about attitude. And attitude is something that we can also work with you on modifying if this is the area where you feel that it's really greatly impacting your test performance, right? For example, some things that would tell me that you have some things around attitude that we need to focus back in on would be if you answered the question and you look back and you missed it because you had mental block or you felt like you were frozen. Or if you felt through the whole test, especially holistically, that you had a trouble concentrating. Maybe there was too much noise or the temperature of the room was wrong, or you felt like there was pressure to keep up with everyone else in the test because someone else finished early, and so you felt pressured to rush yourself. Another one that we might also be, I feel too tired to concentrate. I didn't drink enough caffeine, or I stayed up too late studying, or I've had a really stressful week. I kept having to reread all these questions because they weren't making sense in my mind because for whatever reason my mind wasn't at top notch. Another one might be I felt panicked, and a lot of people have significant test anxiety, and those are things we can give you some tools to help with coping, to help with reducing anxiety in a way that you can get out of your mind and into that exam in a way that you can be successful at it. Or sometimes we have some negative, what I would call negative tapes or negative podcasts we play in our head where we tell ourselves, gee, I didn't know the first question, so therefore I'm probably not going to know the answers to any of these questions, and this is a waste of my time, and I feel like I'm never going to succeed in nursing school because these tests are so doggone hard. Or I'm not performing, and I know I'm not performing well because I just can't right now. And that frame of mind then influences your performance on that entire exam. And those are also things that we can help you through. But part of what we need to do is to capture, and using this sort of error analysis allows us to capture your most frequent reasons for missing questions on an exam. Now, I know you're thinking, oh my goodness, Leisha, you are too way over the top. You are too enthusiastic about this. I can hear it in your voice. You're kind of a crazy lady. And yes, I am. And the reason why I am is because I truly believe that when we pay attention to our errors and we can figure out why they're happening, that we can start to prevent some of those same repeat mistakes in future exams, including in your NCLEX. And my number one goal as an instructor is to help you be successful. I want you to soar through nursing school. I want you to get through that NCLEX, and I want you to contribute to the world of nursing. And sometimes that is harder than it seems like it should be. And so I think that it's an us thing. One of the other areas that I've put into this test review, as far as analyzing your errors, and this is a really key piece that you may not use in your sophomore year, but that in your junior and senior years when you're taking exams that are going to be absolutely crucial in preparation for your NCLEX, is the NCLEX test plan categories. So why is this important to you? I have gone out to the website listed below on that form, the NCBSN, that's our National Council of State Boards of Nursing. They are the ones who create the NCLEX exams. There is a new test plan out starting April 2019. And this test plan determines about how many questions of each category you might get on your NCLEX. As you get into your junior and your senior level courses and you're taking these exams, most of your exam questions are going to fall into one of these categories. If you note that you are missing questions and you can place it into the appropriate category, right? Then you can start to analyze whether or not you have a pattern in a certain area, a weakness in one area of the test plan over another. So for example, safety and infection control and basic care and comfort are mostly covered in your sophomore classes. If you're missing some of those aspects when you go to take these exams, you need to go back and review some of that content and make it stronger, right? As you get into your upper level, your management of care, your pharmacology, all of those things are going to affect your test outcomes in the NCLEX. And if you can start to identify what types of questions those are that you're missing the most often, you'll start to recognize those questions when you take an exam and saying, oh, that's one of my trouble categories. I better make sure I slow down and I read that in its entirety and that I'm extra careful with my selection. By paying attention now, even as a sophomore, even as a junior, and thinking about how you're testing and how your mistakes are kind of piling in and what areas they're in, you're going to become a better test taker, a better student performer, and you're going to have better confidence when you get into that NCLEX situation. So now what? You've looked at your test, you've determined where you are. How do you get the most from your tutorial centers, from office hours, your study groups, that sort of thing? First of all, try to understand the concept or work the problem out by yourself first. And come ready to ask questions, whether that's to a study group or whether that's to a tutorial center or whether that's even to coming to the instructor to ask for clarification and assistance. If you've tried to work on that concept a little bit, it's going to make more sense when they go over the correct answers or the way to get there. Explain the material to the tutor, to the instructor, to your classmates, to your dog, to your cat. Once you feel like, wow, I grasped what I did wrong, and now I'm going to move on in that subject area and go to a more deepening level of my knowledge, part of that is being able to break it down and to teach it to someone else. Get help and get it early. If you're struggling in one of your classes, you do the test analysis, you speak with your instructor, and you call or you talk to Wendy. You ask her about tutor assistance. Tutoring is available to you at no charge through some of your student fees for a certain number of hours. There are quote, smarty cats. We've got students on our own campus who've taken these courses who are able to help you strategize with your learning, to able to help you increase the quality of your study time. Your teachers, if they notice that you're not performing well, that you're not showing up to class, that you're excessively sleepy in class, that sort of thing. If we as instructors are starting to feel like, gee, this isn't what I expect out of you, we are going to start what we call an early alert system. This goes to Yarnell Student Success. Answer their emails, answer their phone calls, talk to them. They have just amazing amounts of resources to help you with. Meet with your professor. If you are in class and they are going over the exam and you want to fight with every single answer that you missed and you just know in your heart you're right, that's great, but don't approach it like that. Ask them to help you understand the reasoning behind the correct answer that they're providing. If there's inconsistency with the books, if there's inconsistency with the slides, that sort of thing, bring that to your instructor's attention. But overall, if you're not performing where you think you need or want to be, meet with your professor. Even if your professor has not referred you into early alerts and you haven't gotten any emails and calls, you are certainly able to call the Yarnell office, the Student Success office. There's a number and an email address here for you. Take advantage of that and call them for extra support. An excellent resource for us here in Great Falls on our Great Falls campus is the Great Falls College MSU. They have more resources even over there. They have an academic success office. You have access to that. There's a phone number, here's an email. They are open Monday through Thursday, 9 a.m. to 7 p.m., which means you can get over there in those evening hours. Fridays, noon to 6. Saturdays they're closed, but Sundays they typically have some open hours. Now, I have not updated these hours since last semester, so do check and make sure that those are the correct hours. But utilize the resources that they have there. They have great study rooms. They have great resources in the library. They have great resources in their academic success area. They have help for math. If dosaging, math calculation is getting you down, get over there early, let them work it through. Every time you have a paper, especially if it needs to be an APA, go over to the Writing Success Lab. They will review your APA, help you get it corrected, and help you attain the grades that you want to have. In all, I just can't tell you enough how awesome it is that you've taken this time to actually sit down and listen to this, to go through it, to print off the exam error analysis, to work on your grades, and to work on your test-taking abilities. I feel like there's so much to learn in nursing school, but we really shouldn't be having all the struggles that we always seem to have with testing, and that there are ways through it, and that we are here coaching you, teaching you, and just cheering you on in this process of becoming a nurse. So don't lose hope. Check out all the resources. Come ask questions. We are here to help you be successful. Let us help you. Have a great day.